Hi, everybody, and welcome back to another video. This is Linda Salter, and today we're going to talk about headaches. And does your headache have a structural cause to it? So let's get started. We're going to look at different ways your structures can be the reason you suffer from headaches. We're going to look at what is offered as an explanation from various sources on the internet. And first, let's look at some basic anatomy, and then we're going to see how to fix them. So let's look at some anatomy here. Here's a nice picture. Um, Especially pressure headaches. People feel pressure. This is an image of your venous outflow, and some of it's the blood to your head. But if you look at it, there's jugular vein, there's the external and internal. And if you see where it goes in to your brain or comes out, there's C1 right there. So often it's not hard to imagine how easy it would be to just put a little pressure on that vein and block the outflow from your brain. And what happens? As you can see, there's not much room for error. There are millimeters of space between these major blood vessels and a bone. What happens when you put pressure on a large vein in your neck, like the jugular vein, which drains most of your brain? I'm not sure of the percentage, but it's pretty high. As you can see, they're big vessels. What happens when you put pressure on a large vein in your neck, like the jugular vein? It can cause the outflow of the blood from your brain to slow down, cause pressure buildup in your head. Can anyone say headache? So here, what happens if jugular vein is blocked? Obstruction of blood flow through the internal jugular vein can cause backflow of blood into the brain, increasing intracranial pressure, which can cause serious brain damage if left untreated. And that's from Very Well Health. What they don't mention here is that it can cause headaches. Yes, over time, increased pressure in the brain can cause brain damage. Yes, it can, because that physical pressure uh, is very hard on the brain. The brain is very sensitive to that kind of stuff, right? It's our nervous system. Um, and over time, also the waste products aren't being flushed out, which can damage brain tissues. So, like I tell people, every cell in your body has to eat and poop. So, blood flow is going to the brain, but the blood out cannot leave, and it's full of toxins, right? The waste of all that thinking. And then, like Dr. Ross Hauser always says, he calls it a brain toilet. So, um, and over time, you can have brain damage from it, different parts of the brain. There is a jugular vein on both sides of the head. If only one side is blocked, then can cause a one-sided migraine headache. Yes. So sometimes, and I've seen scans where people are hooked up to blood flow uh, measurement tools, and they turn their neck and they have zero flow because C1 and C2 here, when you see uh, where the jugular vein, it actually comes out beside the vagus nerve. So if you looked at my last video, and you feel a lot of tightness in there, it's very simple because a vein does not have muscles around the vessel itself like an artery does. The artery does to help pump the blood, but in veins, they don't. There's only one part of the body there is, but we'll talk about that some other time. But yeah, so it's very simple to pinch the jugular vein and close it a little bit. It doesn't take a lot of pressure, like an artery is a little bit harder to close. Symptoms of a venous blockage in the neck. Headache felt like a pressure strap around the head or pressure in the forehead. Does bending forward increase the feeling of pressure in your head? I have a lot of clients that happens to. That's one of my questions. Does does turning your neck in different positions affect your headache? Some people can lay down and their headaches feel better. Some people can actually find a position that makes their headache better. That kind of tells you it's structural. It's really not hard. Um, does laying down decrease the pressure? And what are the symptoms of this? There, like you can also, when you do have blockage of the venous outflow and you build up pressure in your head, so you feel pressure somewhere in your head, you can feel it on one side. A lot of people will have the pressure in the forehead. Some will get, some people have pressure behind the eyes or in the temples. Pressure is often due to outflow. Um, so does laying down, so blurry vision can come with that. Also, sensitivity to the light, brain fog. All that pressure is slowing down your brain, so you kind of have a hard time thinking. You also have a lot of fatigue or low energy, and sometimes you'll hear the somewhere in the side of your head, and that could mean uh, that it's a occluded vein. And those are some of the common symptoms I see in my clients. Okay, what other fluids are in the brain? Cerebral spinal fluid, or CSF. You ever heard of that? That's the fluid that bathes your brain. You can see it. It surrounds your brain, and also it goes around your brain. It's inside your brain. There's 4 ventricles, and then it flows around, and it also flows down through your spinal cord and back up. I think it goes down this way and goes back up. Yeah, so look at this here. This is where the foramen magnum is. That's that hole at the bottom of your skull. Right where, about here, you see it's thicker. The brainstem is thicker. And then the spinal cord itself, well, that brainstem is thicker than that hole, and it does not belong below that hole, but sometimes that can happen. And you can see a little bit of downward of this brainstem can actually plug the hole, and then the fluid can't flow around it, building up pressure in here. You can also get something like a syrinx, and we'll talk about that some other time. We're just doing basic pressure headache stuff today. So cerebral spinal fluid is fluid that flows in and around your brain and spinal cord. Your brain and spinal cord make up your central nervous system. Okay, and cerebral spinal fluid surrounds the brain and spinal cord. Where did that fluid get blocked? Yes, it can get blocked at the foramen magnum. What are the list of structures passing through the foramen magnum? Right, there's a lot of stuff there. Spinal cord, but apart from major structure, other structures passing through which are listed below. So it doesn't say here about the venous, but you can see there are vertebral arteries and spinal arteries, posterior spinal arteries that feed your brain. We're going to talk about that another time too. So it's not just the brainstem, there's actually blood vessels that are along with that brainstem. So here's a picture, an image. There's your brainstem in there. That's your spinal cord. Above the hole is the brainstem. Below the hole, it becomes your spinal cord, and it's all one piece. So when the brainstem does come down, which I think is very common, um, it'll plug that hole. It's bigger than the hole. So you can see that it'd be easy to block fluid that way. If you don't have good posture or looking down all the time, it's the #1 thing. If you have kids, you really got to start them off young before they start developing issues. If you don't have good posture or looking down all the time, you can basically be pulling your brain or brain stem out of your head. So doing this, it's like I'm pulling on your spinal cord and pulling it down. Now, a lot of people don't have an issue in their neck, so they're fine. You know, they might get tension and stuff, but there's a lot of people that have instability, or their C curve in the back of their neck is not nice. They might have an S curve even, or I've seen a scan of a reverse C. That means things are sitting wrong. You're actually taking more length out of your spinal cord, which means there's more pull. It's really not hard to understand. So if your brainstem descends past the foramen magnum more than 5 millimeters, that would be considered a Chiari 1. That's where the brainstem descends past. And people that suffer that, some people have a lot of problems. And again, all these doctors that I've studied from say the same thing. Now, because of proper scanning systems, and they look for it more, it's a lot more common than ever thought before. It's not as rare, but because it's so rare in our books, doctors don't look at it. Even neurologists, I've heard, oh, I've talked to so many people about this. It's amazing. We're just not taught this stuff. And again, I'm not trying to poop on docs and stuff. We were not taught this. The only reason I know is because of Butt-thotics. And one day somebody came in and I tested them with the Butt-thotics, and their headache disappeared in front of my face. Like, and it's not the only one I've seen since. Like, what's going on? Right? I wasn't taught this. So I looked and looked and looked, and I came across all of this information. And again, all these doctors will tell you this is not as rare. And the other day, I actually had a client tell me that she had crowding in a 23-year-old that I've been treating for a while. And I tell her all the time, it's your neck, it's your neck. And it was kind of confirmed because she was told through her MRI that she had a crowding of the brainstem. So the brainstem, here's the hole, or here's the hole, and here's the brainstem. And when it goes down through the hole, it actually will plug it. And that's what she has, crowding of the brainstem in the foramen magnum. They found that by accident, like that's how they usually do. But yeah, 23-year-old. So, and she sits at a desk and she's hypermobile. And she's had a couple of little motor vehicle accidents. Not big ones, but enough to destabilize her neck. So where were we here? So the brainstem's thicker than that hole, so it can plug the hole, and the fluid surrounding the brainstem can easily be occluded as well. And this is called intracranial hypertension. It's not that difficult to imagine. Have you ever heard of this before? I'm pretty sure you haven't. Symptoms of intracranial hypertension. Remember, these vary with everyone in symptomology and intensity. So not every symptom is the same. And like, this is a gradual process sometimes. The more and more damage, eventually your neck posture gets worse, your headaches get worse over time, and then it becomes a really big issue. So you really want to address it. If you have a lot of headaches, I'm sure it's mostly coming from your neck, and you really got to work on that. What headaches increase intracranial pressure? What does increased cranial pressure feel like? Blurred vision, feeling less alert than usual. That's and a headache. That's usually the common symptoms. Those are light ones. More severe ones, people who have more severe pressure buildup of CSF in their heads, headache, blurred vision, confusion, high blood pressure, shallow breathing, vomiting, changes in your behavior, weakness or problem with moving or talking. Also vision, peripheral vision. If you're losing peripheral vision sometimes, that could be, and it comes and goes, that could be it. And it probably has to do with your neck position. You can probably feel it change with neck position. Also, when it gets very severe and you've had it and it's very high pressure, you can actually black out vision. It can temporarily black out and come back. Again, probably depending on your neck. And that's a little bit more serious. Once you have that kind of a symptom, you really want to get that checked out. Yeah, that's a lot more serious. Okay, let's see what the internet tells us. What are the main causes of headaches? Stress, muscular tension, dental or jaw problems, infections, diet, eye problems, hormonal influences, medications. Yes. Let's see. And does location of a headache mean anything? To me, it does. That tells me everything. We're not going to talk about the back of the head yet. Today we're doing the fluid flow causing a headache. So in most cases, the location of a headache is non-specific and non-important in identifying the type of headache. Knowing whether the headache is unilateral or bilateral can help differentiate between certain types of headache, such as migraine or tension. It doesn't really tell you. Yes, the location is important, very important. Back of the head is something different usually. That's usually more like a Chiari type headache, more of a nerve thing, not just occipital neuralgia. It could be a sign of overcrowding in the foramen magnum, a little descending of the brainstem. Pressure, though, A lot of people, they'll bend forward and they feel more pressure. That's fluid. If you lay down and it feels better, the pressure goes down a little bit in your head, that's fluid. Um, okay, and here's another one. Lack of sleep, too much caffeine, fluorescent lighting. Yeah, yeah, yeah. These are all symptoms of another problem, or all of us would have headaches all the time, right? I don't get them. I never get them. Um, once or twice a year, maybe, and they're never anything significant. So these are all symptoms. You already have a problem in your neck, or somewhere. You already have a problem. I drink too much caffeine all the time. I have fluorescent lighting at work, stress, anxiety all the time, but I'm okay. Anxiety, not so much. We all have stress, lack of sleep. Oh, boys, I get up at 4 o'clock in the morning sometimes. Um, yep. So, yeah, there's a problem already. Unfortunately, this information is not common knowledge in the medical field. It should be. It really should. That's why I'm here, because it's not that hard. These are all symptoms of another problem. Okay, there's a problem already and you're sensitive. That's right. So all of those things are stresses to your symptoms. They're not the problem, or all of us would be having headaches all of the time. Also, if you have chronic headaches, you probably have other health issues like acid reflux, cold hands and feet, GI issues, neck and back pain, POTS, and many more. POTS, that's the standing up and feeling dizzy. A lot of people have that. Or other symptoms. These are just a few I put here, but you could have a lot of other symptoms like ringing in the ears, trouble swallowing, heart palpitations, all sorts of stuff. These are all neurological issues, possible neurological issues. And somebody that comes in with chronic headaches, I know they have a few other things because that's what I ask them, and that's usually what I get. A lot of different symptoms, and they're all related to the same thing. Excuse me. Once you truly grasp this information, you'll realize that most people's health issues come from their neck spine. Improve your posture, do a little exercise, back and neck strengthening, massage, or other physical therapy, and you can be well on your way to no more headaches. And if you sit a lot, Butt-thotics to level your hips while seated can help as well. If that is part of your problem, lateral pelvic tilt, sitting on a Butt-thotics would help you. Um, so thank you for watching, and please like and subscribe. Um, this isn't just about selling my product, Butt-thotics, which is an amazing product, and we're seeing great results. It's about learning about all of this stuff is related to your neck. It can help you, your parents, your brothers and sisters, your friends. If you learn this, it's not that hard. It's just not common knowledge. Like, I'm putting this out for free. I don't really care about selling anything or whatever. I believe in my product and it will sell itself. But this information, I can help so many people with it. There's not a lot of people talking like me out there. On my Telegram channel, I post a lot of videos from Dr. Ross Hauser. He is the expert because he has all the proper scanning systems. He's been doing this for a long time, and I've watched all of these doctors, neurosurgeons. They are very smart too, but see, the neurosurgeons only see the people when they are debilitated. They don't see them when they're on their way to debilitating health problems. And they even say once they fix your neck, most of your symptoms disappear. They're all related. We will do more another video on headache, the ones from the back of the head, because that's could be a whole other thing. So, yeah. So share this, like, subscribe, give me some feedback if you can. I know I'm just started and I haven't really advertised this, so this is gonna grow organically. That's how I feel about it. There's not gonna be any fancy commercials or anything like that. Um, I prefer following and listening to people that are pretty normal and not all show. So, I hope you like this stuff. I got lots more. Please join my Telegram channel too, and I'll put that all in the description, and we'll talk to you soon. Thank you.